Okay, well, welcome to Dr. Z PhD interviews. Today's special case is Aidan Olsen-Kennedy. Aiden is a trans-affirming mental health therapist and also executive director of Los Angeles Gender Center and trans advocate. Welcome, Aiden. Thank you so much for being part of interviews. I'm so excited to interview you. Primarily because you and I are both colleagues in the exact same field, and especially because you've been in this field way longer than I have. So you have way more expertise, and it'll be very interesting conversation today. So welcome.
Thank you. Thank you for having me. I'm excited.
So for starters, why don't you share a little bit about yourself, where you come from, a little bit more information so the viewers can get familiar with who you are.
Sure. So I'm a licensed clinical social worker. I've been in the field, specifically working with trans and non-binary folks for about 10 years. And I moved to Los Angeles in 2013. And at that time, just really pretty much focused in and exclusively work with trans and non-binary folks. In the last couple of years, I would say there's been a bit of a shift to my practice where I've really focused in on working with parents and caregivers of both like younger kids, adolescents, and young adults, but also parents of adult children who have recently disclosed to their families that they're trans or non-binary or transitioning. And I find that really, really meaningful. And often a place that as a trans provider, I think that sometimes we are not particularly inclined to meet with parents, and I understand why that would be. I find it really exciting, but I continue to work with adolescents and people all across the age span. I transitioned when I was 31. So that's 15 years ago, at a time that was very different in a lot of ways. I transitioned in a smaller town and access to mental health care was horrible. And it felt, I was having to drive 3.5 hours each direction each weekend to meet with a gender specialist and paying, certainly what was above normal rate even then. And the whole thing just felt like I was being exploited and taken advantage of as a trans person. And that experience, or some of those experiences, have really guided and informed how I want to practice now, working within a marginalized and exploited community. So
yeah, I appreciate the work you do very much. Especially, I know that you're one of the very few providers in California that offers evaluation letters for surgeries for free, which I think is an amazing, amazing resource. And now I can understand, hearing a little bit about your past, how it led to that. You're also executive director of LA Gender Center. What is the mission behind that, and what is the goal behind Gender Center?
So the Gender Center is sort of an interesting, sometimes I call it a beast, but maybe clarify that. So the Gender Center started in 1992, sort of organically in a way of like a provider started working with primarily trans women, and then the need grew. So she brought more people in and brought more people in, and then it eventually evolved to the Los Angeles Gender Center. Although in the entire time of its existence in the 30 years, there's been no physical center. So there's been some confusion around the name, but we have that entire time provided mental health services, and really grew and focused in 2015 as part of our mission, realigned mission of bringing on trans and non-binary clinicians, and really centering the voices of trans and non-binary people. Because up until that point, it was mostly cisgender providers, which is fine, but also there's an opportunity to provide services from the community for the community. So that's definitely, central core part of our mission, but also accessibility, sort of like what I was just talking about is that we are really committed through both education and training, so training other providers to increase access, but also within our own network, making sure that there's people who are at a variety of different pay scales, so that people who are resourced in a variety of different ways can access. So the mission is access both in part of how we provide services, but provide training to future clinicians such as interns and associates, for example, who can see people at a lower cost while we're also providing training around gender specialty work.
I love one thing, especially about the LA Gender Center, among a lot of other things, of course, but one of them is what you just said, how you guys progressed to making sure that the mental health providers on board are non-binary and trans-identified. Why do you think it is so important? I think it is also important. I agree with you. I think cis people obviously can also be providers. I'm one of them. But I also think it is important to make shift to have much more gender diverse providers in the field. Why do you think as a clinician, it is so important to have more trans-identified binary or non-binary providers in the field?
I think that there is an inherent value around community members who often don't see themselves reflected in the world around them, right? That as trans and non-binary people, we may see versions of ourselves in media or sort of in other places, but it's always through the lens of almost always a cis person's perspective of a trans person. And so when you can have a clinician that is trans or non-binary or not cisgender, and they are disclosed about that, it just creates opportunities that I think are really healing for trans and non-binary people to see themselves in someone else, and to see somebody who is, is able to reflect back a variety or a diversity of ways that people experience or express or talk about their gender, and also a variety of different ways that people kind of live their lives, their gendered selves in a variety of different ways. So there's not a lot of pushback, but I think a lot about that there are some folks, cisgender women who are like really wants a cisgender woman therapist, and I think that as a practice or as a community, we don't really bat an eye to that.
Yeah.
Right. And it's like, well, yeah, that makes sense. Or like maybe a gay man wanting a gay man therapist, we don't really bat an eye to that. But there has been a little bit of resistance around trans and non-binary people saying, I only want a trans or non-binary therapist. And I think that has been an interesting thing to observe. Cis providers who see themselves as allies, and they are allies, have some feelings emerge when they are told that they are not the number one choice for trans and non-binary clinicians. That's been an interesting thing to observe.
Interesting. I can imagine that happening for sure.
Yeah.
I do think that in therapy, it's all about relationship. And I think that whoever it is you establish relationship is of utmost importance.
Yeah.
Now, talking about therapy, and you've been in the field for a long time, and you have been worked with a lot of individuals. One of the biggest questions that I tend to ask, and I work primarily with adults, so we're going to focus on adults here.
Sure.
One of the biggest questions that that I've been asked by adults is whether it's possible that they're being brainwashed and thinking that they're transgender. Is it possible that they're being so highly influenced by social media or transgender movement or any other things to the point where their mind literally has convinced them that they're trans? I want to hear your opinion on this matter. Do you think it's possible? Have you seen this happen in your practice?
Do I think it's possible? Sure, it's possible. Do I think it's probable? No. Have I seen it? No, absolutely not. What that is to me is a symptom of something that is actually much more pervasive and actually is happening. And that is the persistent messages of invalidation around trans people and trans people's experiences, and also the evolution of coming to recognize and then use the language of being trans, right? So there's a time during people's kind of coming in process of recognizing like something might be going on. And of course, the attention is going to change, right? So social media consumption is going to change. Maybe what you're watching or listening to, those things are going to change based on what we were just talking about before, is like you're looking for yourself. You're looking for something that is recognizable. The narrative that happens, or the thing that gets exploited, is that in people's natural and appropriate process to find things that look like them or have their story, that's then used as like, well, you're only consuming this content and therefore it's brainwashing you.
Right.
So that's how that happens. And it's a very cis-normative and transphobic, not in the sense that I think we sometimes think about transphobia, but it's the consequences of a system and a society that is really interested in a very narrow narrative of what people's gender and sexuality is. If there is a scenario in which somebody is going to be brainwashed, it is cisgender narratives that brainwash people, right? There's an abundance.
Very well said, yeah.
Right, there's an abundance of that, and there's possibly cisgender people out there, given the right sort of opportunities or spaces, may find a wider berth for their own gender identity and expression, but there's an abundance of cis narratives. So I think that that's actually sort of where brainwashing, if you would call it that, sort of the influence comes from.
I love that. I'm going to steal that. I actually haven't thought about the reverse brainwashing effect, where in fact we are, as majority, have been brainwashed by cis-normative and heteronormative, not only ways of gender identity and gender expression and gender roles, but also sexuality as well. So I'm going to steal it. So if you see a video with idea talking about this, it's Aiden's idea and I'm stealing it. Now, you noticed, and I have noticed for sure, that lately we've been having a lot of people coming out and identifying as trans who are much older. And one of the things that I noticed is there's a pattern with them struggling to accept that they truly are transgender. It almost seems like there's a correlation between the older you are and the longer you kept your identity in regression or in repression or hidden, the harder it is for you to accept it. Why do you think that is for all the individuals so hard to acknowledge that they are truly transgender?
There are, from my perspective, I think there's a couple of contributing factors. I think that anytime any person, whatever that information is, the longer you've held that in privacy, and I think that privacy sometimes with something is kind of manifesting that feels like secrecy. I think anytime any of us hold something for a long time, it's harder for it to come to the surface. And I think that that's relatable of regardless of your gender identity or sexuality to the audience. Like we all have things that really have been not spoken, and to talk about them, it's so much more challenging. So I think that's part of it. I think that the other thing is that the older you are, there's more life, there's more things that are tangled up in people's perception of you, right? So maybe that's families and children, but also maybe it's not. Maybe it is careers, or maybe it's just neighborhoods, right? That you know, the life of a, let's go 20-year-old, right? So there's been 15 years of active life, because those first 5 years, there's not a lot of activity going on. But you have 15 years of things that you sort of have to like clarify and say like, oh, actually is this. But at 40, you have 35 years. And at 60, you have 55 years, right? So I think that it's just harder from that perspective. The other thing is that we're at this interesting time, and I think we have been for probably the last 5 to 10 years maybe, is that the more young people are able to find the language and disclose and talk about their gender, and then subsequently access transition earlier, in some ways, I think that that has been internalized as invalidating for people who are later in life kind of coming to realize and recognize their gender, because it gets internalized as part of that previous narrative we were talking about of like, if I was really trans, then why wasn't I talking about it like I see X kid on this documentary? Right. So I think it gets invalidated, which then just sort of makes that, pushes that secret down deeper, which makes it just harder for it to be exposed. There's just a different, you know, I mean, I don't know how old you are, but I'm, you know, almost 45. And I think about, you know, what did I understand my gender to be, and how could I have talked about it when I was 16 in 1993, right? Which is not that long ago, but long ago. I didn't have any concept at all. Like I had no language, there was no framework, you know, and so I think it's challenging for people who have kind of come to this information or synthesized and put it all together at this time when there's so many young people talking about it. It becomes this comparison of like invalidation, and then it just takes longer.
Yeah, I noticed a lot of comparison out there, like you said, to the youngsters, right? I hear a lot of people saying that, why don't I have a memory of this? Oh, how come I have not formulated my gender identity at age 4 or 5? Again, there's this clinical narrative, classic narrative, I call, you know, kind of false clinical narratives that people tend to perpetuate. And the reality is that not everybody is aware at age 4. You probably were aware, but you didn't have a language to apply to it. So you don't really have that formulated experience. So I agree with you. Looking up a little bit more intel on you prior to this interview, I came across an interview. I actually saw this interview prior to looking up intel. I saw this probably about 4 years ago. And it's an interview with Jim Breslow on Hidden Truth Show. And I remember when I watched it, it really got under my skin. And during this interview, Jim is pretty much asking you whether there is a correlation or causality between gender dysphoria and trauma. And he's really trying to drill it in that there's got to be something traumatic about people in order to identify as gender diverse. And it bothered me. And I saw in interviews that it clearly shows that it bothered you as well, as you were trying to so clearly articulate that there's absolutely no correlation whatsoever. Why do you think society continues to grasp to this idea that if you are trans, you got to have a trauma? Trauma led to your trans experience.
Gosh darn, that interview was so frustrating. My goodness.
It looked very frustrating.
I did not do my due diligence prior to that. Like now I do much more sort of like, who is this person? What's your perspective? And I didn't, and I walked into that and I just was not at all prepared for his angle or his position. Lesson learned. So I think that, well, I think that for a lot of people, just the experience of itself, in and of itself, of having gender dysphoria, particularly that's untreated or undertreated, I think that it does feel traumatic, and I think it does manifest itself as trauma, right? And so I think that when you look at it, from an outside perspective or on the surface, I think that the language or the framework of trauma, if we broaden it a little bit, I do think that there are places where it actually does apply. But I don't think I don't think that trauma causes
Trauma
the trans
itself,
part, right?
right?
It's like the gender dysphoria is causing experiences of trauma. But that's an old, when we think about, I mean, I'm teaching a course on LGBTQ history and trauma, ironically. And so looking back and understanding like where the narratives of trauma around gender and sexuality, that was in the 1600s, 1700s, 1800s, right? And so it's been there for a very, very long time, and it's moved through different identities. I think that we're holding on to it. Hopefully, the next generation of people like you and I doing this work, it will not be part of the narrative. We will be able to say like, yes, that was put to rest in the, in 2020, whatever, right? There is a higher correlation for young people who have experiences different than the norm. They have a higher likelihood of being exploited. There's a higher likelihood of trans and non-binary and queer kids to be exposed to sexual and physical trauma, right? And so when you look at those numbers, you have to see them for what they are. But in order to see them for what they are, you have to be willing to see them for what they are. And if you go in with a very narrow or prescriptive idea of what that is, as a social worker, as a trans person, I've actually also arrived at this place. I think I've been here for a while, but I don't know that I always spoke about it, is because I don't know, working with kids and parents, it's an interesting kind of line that I walk sometimes. But let's just say, for argument's sake, let's just say that for some people who have experienced a lot of trauma, living in a different gender identity, gender role, and gendered body is a result of their trauma, but they're happier. They're happier, they feel safer in the world, they're able to function better. Great. Like, why is that a problem?
I thought about exactly the same thing. Even if it is hypothetically speaking, and we're talking about hypothetically clearly, a result of trauma, but it can help person cope and have a more adaptable, happier life.
Great. Fantastic. Right. And I mean, before I came out as trans in my 30s, I came out as a lesbian. So I lived in sort of the queer world from 15 to 30. And again, that was the mid 90s. And I remember the same thing. It's like, oh, you must have been sexually abused. And it's like, well, whether I was or was not is irrelevant to the fact that I actually have a sexuality, as do you, and you, and you, and you, right? And so that narrative was pervasive, just like the trauma sort of, it's like, it's moved through communities and people, perpetuated and reinforced by those who have the power and the most oppressive, right? And it's the pathology lens, right? It's sort of where the pathology of gender and sexuality came from, is like, there must be a cause, and the lowest fruit cause on the tree has to be trauma, right? And so it just sort of has been perpetuated. And there's providers who have gotten national, international attention, who reinforce this narrative, right? And have published about it and have been given leadership positions from this perspective, and reparative therapy from a trauma perspective. And so you have folks like you and I and other providers who are on the ground, right? Working with people, but we are not sitting in these, international high level positions with a broad voice. You look at the standards of care and you can see trauma woven through there around, well, make sure. It's like, so that's being reinforced. So you and I are working uphill against this larger sort of system that is reinforcing this false narrative.
Yeah, in fact, I will be the first one to go on the record and say that I think a lot of guidelines, even WPS guidelines, reinforce trauma in individuals and reinforce 100%. Yeah, and just societal things, lack of support, lack of resources, all of the things. And even the person who interviewed you, just talking about it and pushing that agenda is reinforcing trauma in trans people. So I think it's actually the other way around. And I think it's very traumatic for people to hear those things, very much so. Now, I also, on that particular show, Jim was trying to get at the root. What is the root of trans identity? How does one person know that they're transgender? Almost he was looking for this kind of a cookie cutter, predictable way to predict if somebody, as if you can give somebody a psychological test. Now, you and I know that there is no psychological test that we can give a person that will have a conclusion that the person does have a trans identity. We have testings that will conclude how severe the symptomology is from having gender dysphoria, right? Depression, anxiety, and so forth. And you said something on a show that I thought was incredibly true. You said the gender lives in a head. The gender identity lives within one's head. Can you elaborate more on that for people? Because I think a lot of people are looking for a different concept outside of a headspace type of deal.
No one really knows scientifically the origins of where people's gender identity lives, right? But or the origins of it. But I think that it's reasonable assumption, and it's a logical assumption, both from like a lay person, but also from like a scientific perspective, that gender identity is one of the numerous identities that exist within our sense of self, the brain or the soul, or sort of however you want to look at that. And if that's the case, which I believe that it is the case, the process in which people need to go through, or the pathways, or the certain sort of exposures that the weeds of that need to be cleared out to sort of find the language around that, it makes sense if we lived. I used to hate the argument of like, well, if you were on an island by yourself, would you still be trans? It's like, well, A, I'm not an island by myself, and B, that implies a whole host of things, that I'm only trans because people are around me, that's the only thing that makes me trans, right? As opposed to I'm trans and I live in a world of people around me and I have to figure out how to navigate that world, right, which is the actual conversation, right? If I was an island by myself, I'd have to navigate a whole host of things, but I'd still be trans, right? But I would just be navigating different things. So when we think about like the inherent nature of gender identity, the inherent nature of sexuality, that those things exist within us, and then we are presented with a variety of different pathways in which we need to align or they already are aligned, and the decisions that we have to make around those things. And I think that there are probably people who experience their gender identity as not something that lives within their brain or lives within themselves. And the for you and I as providers, and I think for me as a trans person, other trans people, just the idea that we've been asked to think about and answer questions that are around like, is it trauma related or does it live in the brain, right? Those things are a absolute result of cisgender narrative that is oppressive upon trans and non-binary people and our allies, to have to position ourselves to be like, well, let me tell you more about this, right? Like answering those questions is a symptom of the cis normative, oppressive, ultimately traumatizing perspective. I suspect that, just like they spent time and energy and resources trying to find the gay gene, right? The sort of causation of that. And, thankfully that has been abandoned for the most part.
Why?
I think
why?
Why was it abandoned, or why did they do?
No. Why even bother? I mean,
yeah.
What are we going to do, test babies?
Right.
What's the point?
And determine if we're going to terminate a pregnant, like, right, what's the point of that? And I think there will be continued efforts to do the same thing around gender. I mean, there's studies in other parts of the country that have been both utilized and criticized around, sexual dimorphic portions of the brain, and that they were different or similarities. And then they're like, yes, but those people had HIV or they smoked or whatever it is. But there is a sort of chasing your tail piece, as long as you're in this causation relationship with people's gender identities, except for cisgender people. No one's looking for the causation of cisgender experience at all. No one's looking for that. And people really should, because there's way more cisgender people. So it's a better group to study from like a data points perspective. I do think that gender identity lives within our sense of self and our soul and our brain. I want to push back against that being some sort of way of people having to defend their existence or defend who they are. If your gender identity lives in your pinky nail, then great. You should totally go do your gender, regardless of where it comes from, why it's there, and what do you want it to look like. And we got to push back against this idea of causation.
Yeah, I think one of the bigger things that people in the media and just in general professionals tend to disregard because they're focusing so much on causality and all those things. One of the things nobody is really talking about is that for individuals, again, I'm talking about adults, just because I work with adults, for adults who are identifying as transgender and are going through transition, if transition is the path for them and whatever that entails, once they complete it, once they feel more congruent, people are out of our offices. People are out there living their lives, being happy. And they, seldom think about it. I mean, of course, for some people, gender dysphoria does creep in. We live in societies that are still very binary, but for majority of people, they're out of the offices. And I think that's something that people seldom talk about, is that people are happier, more holistic when they do transition.
Mm-hmm. Yeah, absolutely. And the less restrictive, less oppressive the pathway was for them to get access to the services they need, whether that's, whatever that is, surgery, legal or other medical interventions, the less traumatic that pathway was, the higher likelihood that they're going to sort of live a life that is reflective of sort of all of us trying to do our life, but it's not through the singular solar lens of I'm trans and I have gender dysphoria. When we look at people, I think that the whole regret narrative came out of a group of people who were put through the ringer to try to get access to services, and were told falsely and inappropriately that there was a cure. It's like, there's not a cure. There are interventions that can decrease. There are things that can help you, and you will still be trans living in this world, which means something. That's not nothing, right?
Exactly.
And so we don't critically look at the, why is it that people, even after transition, maybe be having a hard time? We don't really look at that in a complete way. We, or what are the things that have allowed people to do pretty well and bump around like the rest of us, but within sort of, the normal bounds of being an adult bumping around in this world. And there are really, for me, identifiable clear factors that relate to both of those and every other scenario. And they are connected to our environment, our family of origins, our friendships, what that process was like, how many times we had to meet with a therapist when we didn't want to get a letter for something, right? Like all of those things build up and they contribute to people's longevity of overall happiness and stability.
Yeah, unfortunately, that is so highly overlooked. I have a video where I talk about how many people actually did transition, and I talk about statistics in relationship to adults, and I put down articles and things like that. And the statistics are very few for adults who did transition, and majority of them, the detransition reason is not because they realize they made a mistake, but because of just exactly what you said, lack of support, societal pressures, everything they went through that made it so much more difficult. Now, I'm not negating that there are people who detransitioned for reasons, realizing that this is not their gender identity and they thought it was, and it wasn't, and that does happen. But I also think it's important not to look at those individuals to be as a key component to indicate that the majority of people think like that. And that's against used, very small statistics are used for majority, unfortunately.
And to that point, if we had a different relationship with gender, those few people who did kind of recognize and realize like, oh, this isn't exactly right for me, we wouldn't care. It wouldn't matter, because it would be like, great, this is fantastic that you got data and now you're going to do something different. But the fact that we use even this small percentage, we exploit those people's process to reinforce a narrative that we want to apply to everyone. And so it's unsafe even for those folks who are like, this wasn't exactly right for me, right? And I think that those folks have bared an unfair and inappropriate burden that anti-trans people are using to exploit their narrative. And I think that's just terrible.
I agree. Do you see a lot of exploitation of kids statistics, children, teenager statistics, in the sense that it is true that we are seeing a lot more younger people speaking out about their experience and realizing that it wasn't for them for whatever reasons. But I see a lot of using those experiences being generalized to older adults. And I think it's completely two different things. I think there's a big difference between an adult that's been struggling with gender dysphoria all their life versus somebody who's younger. It doesn't negate that younger people may absolutely know from the get-go their gender, right? But there's something a little bit more for the adults. Do you see that being exploited as well?
I do, because you have more people's opinions, because right, when you're a minor, you have like your parents' observation, your parents' perspective that is oftentimes more influential than the voice of the trans or non-binary person themselves. But there's something about if well, also the regret and detransition rates of young people who engage in medical transition are all also astronomically low. And a lot of that data came from the Netherlands, right? Where it was people were accessing care, and in that part of the country, you're considered a legal adult at 16, right? And so there was a whole host of people who were lost to follow-up data when they turned 16. All of those people who did not continue to engage and report in the study were characterized as detransitioners. And so the data was wrong and inaccurate. And I've had the opportunity at different international conferences to listen to the authors of that data and then talk about, it was interpreted this, it was not this, it just means we lost track of them, which actually might mean that they didn't detransition, maybe they are off doing their lives, right? And so much data and so much research does get, you pick and pull, right? Yeah. And you're like, oh, that thing reinforces the thing that I want to talk about. And there is, it's so easy for people to regurgitate and repeat what they think they heard, and then that, right? It just becomes like the telephone game.
Exactly.
And next thing you know, it's like way off the chart. So are there, quite a few kids, prepubertal, like young kids, who particularly in today's time and space are playing around with gender expression? And absolutely, that's always been the case, right? There's always been boys who liked girl things for a period of time. We used to say like, oh, that's gay, and we would do a reparative thing around that. But for kids who are experiencing their gender, and as much as I'm not a fan of organizing care around distress, I think it's deeply problematic. There is this place where I think that it is important that there's some level or some place of like, this is starting to cause me discomfort, this is starting to cause me distress. That's the point where we create intervention, as opposed to, well, you have to be in distress for 6 or 8 months and have trauma, and then we're going to use trauma to invalidate, right? So I don't think there are more or less younger people who are detransitioning. I think that younger people also see and look at their gender in ways that are very different than adults. And so we see something as doing something different, and they see it as just an expansion upon who they are and what's going on. Exactly. It's a forward movement.
Yeah, I've seen it before with people who were identifying as one particular gender expression, then they shifted because they were exploring it, and people would call it as, look, you don't know what you're doing, when in reality, for a lot of people, gender is an incredibly fluid concept, and it changes throughout your lifespan for sure. So since we are speaking on kids, I wanted to touch base on one thing, since you do work with children and families. There's a lot of misconception out there that kids are irresponsibly walk into the office and declare that they're transgender, and there's this incredible affirming therapist that doesn't ask any questions and immediately sends them into surgery. And it's such a big misconceptions about surgery and kids being able to get surgery immediately, or kids being able to get access to hormones immediately. Can you clarify that misconceptions for somebody who worked with kids?
Absolutely. In order to get access to intervention, you still need a diagnosis of gender dysphoria, which means that you still have to meet the criteria of at least 2 of the criteria present for 6 months, right? So that's still, which is part of the reason why rapid onset gender dysphoria, one of the millions of reasons why that was total and complete nonsense and doesn't exist. It only became a thing because people said it was a thing, which doesn't make it a thing. And so yes, that process is still the same. I think that what is different is that for children, I would say adolescents and young adults, that there is an appropriate opportunity to have kids and young people be peer concordant. That's important. We know a lot, there actually is a lot of data and research about what happens for cisgender kids who are late to puberty, and there are actual psychological, sociological, psychosocial consequences to that. And we sort of, from a medical community, validate that, mental health community validate that, of like, yeah, if you're a cisgender boy and you're 17 and you haven't started puberty, yeah, that would make sense that would be hard for you. Like, we can wrap our heads around that. But if you're a trans boy, it's totally fine that you're 17 and you haven't started puberty. You need to wait till you're 18. Like, all of a sudden, what was logical here is illogical there. So, to answer your question directly, like, there's still, the diagnosis is still required. And medications, pubertal suppression medication is not brought on board until somebody actually starts puberty. And both puberty, like the visual cues, but also oftentimes blood work to confirm that, Its pubertal suppression medication is 100% reversible. We've been using it for decades and decades and decades for 4 and 5 and 6-year-olds going into puberty, which nobody wants. And cross-sex hormones or gender-affirming hormones are part of early intervention that is appropriate for that young person and that family and the system that they're in. You know, trans boys, it's appropriate that they start puberty at 13, 14, 15 years old. Trans girls, it's actually appropriate that they start puberty at 12, 13 years old. That's appropriate. So are people pre-pubertal getting access to medical care? Absolutely not. Transition-related access to medical, and if they are, someone needs to report that provider. It's inappropriate, absolutely inappropriate. And for the most part, minors under the age of 18, for the most part, are not getting access to the majority of surgeries. The exception to that, there's probably 2 exceptions. Obviously, the most common is trans boys or young men who are getting chest surgery. And again, I just want to create a parallel. We universally understand that a cisgender boy with gynecomastia can cause problems socially and interpersonally for that person,
yes.
Which is why there are numerous pathways for teenage boys to have surgery to remove gynecomastia, breast tissue. Unless you're a trans boy, then it's absolutely appropriate that you have boobs and that you should just figure out how to live your life with a boy with boobs. So there are pathways that we understand, like it's important that transmasculine people get access to surgery. So there certainly are people under the age of 18, and appropriately so. After having diagnosis, after sort of going through, you know, a process, is there a lot of gatekeeping, which is a different conversation about how I feel about that. There are some trans girls who are getting access to surgery, vaginoplasty, prior to the age of 18. And again, what we don't think about, you know, particularly for kids who are blocked, so let's do a little medical piece here. If you're a trans girl and you're blocked at puberty, what that means is that you have Tanner stage 2 or 3 genitals, which like just put like an age on that. If you are a 17-year-old girl and you were blocked at puberty, that means your penis is roughly the makeup and the size of a 6 or 7-year-old boy. And now you're 17 years old or 18 years old, and you're negotiating appropriate levels of emerging sexuality and relationship to your body, but you have genitals of a child.
Yeah.
And so those people getting access to surgery is critical so they can launch into adulthood, given the best circumstances we possibly can give them. But otherwise, people are not accessing surgery. People are not getting breast augmentation or facial feminization surgery or phalloplasty or Brazilian butt lift. I mean, those things are not happening for people under the age of 18, regardless of what people think is happening.
I'm so glad you clarified, because people forget how much footwork in the process there is leading up to any of these interventions. And it's being so perpetuated. It's, you know, you walk into the office and you're a minor and you walk out with a bag of hormones and you walk out with a bag of all other things. And that's clearly, even me not working with kids, even I know that's not the case, but I'm glad you clarified since you do work with kids.
Yeah.
I also dug up at 2008. It looks like it's a little bit of a vlog, 2008 video vlog that you did prior to starting actually hormones, which was very interesting to watch. I could not recognize you at all. It's like, who is this person? And there's something you said in there that I'm going to quote here. You said that there's ignorant people's statements of me becoming a man, and that I'm suddenly going to become this aggressive person, which I hear a lot of these misconceptions about testosterone and increase in aggression, increase in moods. You've been on testosterone for a long time. Did you turn out to be a raging aggressive person?
No, I think that I am probably more sensitive now, and I think that I see the world from a place that is much more connected to emotions and vulnerability than I could before. You know, I forget that you know, that's up. When I first left graduate school, I had somebody who was like, you have to take your YouTube videos down, right? And it's like, and I thought, well, A, you have to put a lot of work into finding those anyway, but also B, I actually don't. That's not the life I want to live. I actually don't want to live in this way where I sort of cut off what was a really important part of my life. But, you know, what did happen, what I do recall happening is it was harder or to find my emotions it's like I had to create a different pathway. I do recall it sort of like feeling different, but now knowing what I know and being older and sort of from a clinician perspective, I don't think that was the result of testosterone. I think that was the result of having testosterone to treat my gender dysphoria, which turn the volume down on some things, right? And so when that volume turned down, I think I had to like remap, right? Like find oh, I don't have to access these things through this like horrible untreated gender dysphoria, which made sort of heightened certain emotions and feelings really accessible while others were not, right? And so there was a remapping of things. But I also, you know, and I think that we do know more about this now, and hopefully people talk more about it, but no one told me I was going to go through menopause and puberty at the same time. No one told me that. So as I was starting to experience those symptoms, which includes having a hard time concentrating, you can't really take information in the same way, I was emotional and I was irritable, I thought, oh my God, what have I done? Like I had an internal panic attack. I think there's one video where I actually talk about it. And then somebody in the YouTube universe somewhere sent me a message and was like, dude, you're in menopause and puberty, you're fine. I was like, oh, thank God. Because I was like, this was the worst decision I've ever made. I feel terrible.
Unbelievable.
Yeah, and during that time, I wasn't panicking where I was like, I can't feel this. But there is, for me, there's a level of responsibility that I feel like I understood I began carrying it very early on, particularly as a white man, that there is a lot of space for me to behave in all sorts of ways that is not aligned with who I am, but culturally there's a lot of permission to do and a lot of space to do. And I think that each transmasculine person, particularly white transmasculine people, I do think that we have to wade through those waters consciously. Yeah. And we have to find our place in our pathway. And some people, where it feels best for them is not where it feels best for me. And it's easy to put judgment on that. Other people, it takes a while to sort of find your groove. And there's all these external contributing factors, but I never once experienced an increase in anger or aggression. There were moments where I felt frustration easier and lashed out in these really absurd, embarrassing ways that I think I did because I knew that the consequences were different for me being seen as a white man than being seen as a queer white woman, right? That, you know, and so there were these moments for sure, but I think that they were not about testosterone. I think it was about all of the factors, the puzzle pieces were all shifting and moving. And once they sort of stabilized, you know, like I still get frustrated, but I don't verbalize that in the way that I did sometimes during those times, right? So it is not, I think that there is a tremendous opportunity if people are given the space and the support to be very reflective during this process of transition and making conscious decisions and choices about how to be in the world in this new body, right, in ways that people are going to interact with you differently. I am changed because I'm socialized. I've been socialized differently now for the last 15 years. I'm a different person purely on that interaction. So when people are like, I'm not going to change, it's like, well, yeah, actually you are totally going to change. A, that's fine. And B, you have to look at the reasons of why that is. Because people are not going to interact with you the same way. So you're going to change as a result of that.
Yeah, I love it when people say, I'm staying the same. I'm the same person. I'm not going to change. And my answer is, there's parts of you that's going to stay the same, but you absolutely will change. And there's parts about your dormant gender identities that is going to completely change you overall as a person. I love how you mentioned that you felt fine keeping that video online because that is part of who, you know, that's still part of you. And it clearly shows that you do think that integration or having some kind of integration of the past and present is important. Do you feel that's important? Because I see a lot of people who are so eager to just completely cut out and disregard their past as if it never happened. Why do you think that's important?
It's certainly important to me. There have been small periods of time where I was not disclosed or not out as a trans person, and I found it to be, for me specifically, more disruptive and more distracting than the period of time when I knew that I was trans and people didn't know. So like right before I started disclosing, which was a very distracting and disruptive time. Now when I'm not out, I'm so preoccupied with like that for me. But I also think it's very critical that my gender and my transition really has moved my life in one direction, and that direction has been positive.
Mm-hmm.
That direction has been about, I have closer relationships with my family. I met my partner through this. I have an entire career that is organized, right? Like I have been met with, there's been obstacles for sure, and it hasn't been without its challenges, but from a, what's the positive and the negative columns, I have a lot of positive, and so that creates a relationship in which I can hold on to and integrate parts of my life that I want to, because it positively impacts me.
Mm-hmm.
If that was different, I think that I would choose to do it different. So it's part of privilege that is like, if you receive a lot of support, you are privileged. Unfortunately, you're a privileged trans person because of that support. So the other side of that is that, and that's my temperaments, right? I mean, I'm having this interview with you and there's a million clinicians who'd be like, absolutely fucking not. I'm not going to sit on YouTube, right? So there's just a temperament piece. But I think that there are trans people whose temperaments or their circumstances has not really led to them being in a place where they're compelled to sort of have this integration and be part of like open dialogue. And they're, and that's fine. And I think there are people who can be very healthy and very happy and adjusted, and keep their gender history very private. I think it is the difference between private and secret. And I think that when your gender history feels like a secret, there are going to be consequences to that. Like there are consequences to all secrets.
I love how you separated that between privacy and secrecy, which I agree are two. One, privacy is much more having to do with acceptance and knowing that you have that history. Secrecy almost sounds a little bit shame-like and guilt-like, right? It breeds those feelings. So I like how you differentiate there. Speaking of therapy, and speaking of adults again, clearly you and I as clinicians, we know that therapy is just great, beneficial for anybody, period. But we also know that it's not accessible to everybody and it's not something that even affordable for everybody. Speaking of therapy, do you feel that for adults, it's mandatory or even needed? In other words, can adults transition and, get to their finish line, wherever it may be for them, without going through therapy, other than this evaluations that they need for insurance purposes?
Absolutely, most definitely. And I think that that's true for a lot of youth as well. I think where therapy is most beneficial, whether it's a youth or adult, is for the people around them. I think that trans and non-binary people, if they don't want to participate in therapy or can't, or whatever the circumstances are, but the people around them did, I think that the trans and non-binary person would be better off for it. So do I think that there is a role, a value? Can therapy be a positive tool?
Sure.
Absolutely. I think what we have messed up for a long time, and I see it shifting now, both with adults and adolescents, is the pre-transition therapy requirement. That it was problematic because it asked people to imagine something different without providing anything different. And so people were having to make things up, or we were preemptively causing people anxiety when we didn't actually really know if that scenario or circumstance was going to happen. But it just reinforced a very singular, narrow narrative, right? And it was like the trans script. So it's going to say this and this and this. And for people where that wasn't true, like I very much told a transcript in my therapeutic process because my story was not in line with what I thought it needed to be to get access. And the longer I engaged in a therapeutic relationship, it was not true. And the more, essentially I was lying, the more harmful the therapeutic relationship became, right? And so I think that therapy can be a tremendous tool for people who want it the first couple of years during that social medical transition. Because like we were saying before, is that you will be different as people interact with you different. Right? You do need support as you're navigating these things that are brand new, and it seems like everyone else knows how to do it, but you don't. And how we internalize and make personal meaning of like, I don't know what I'm doing. A therapist is a great place to say like, well, let's take a closer look at that. Like there's just opportunities. I think that if people are engaged in therapists that are not, they don't have enough experience, or they are in this place of, you know, always looking for regret and creating a very narrow narrative, I think that therapy can be just as harmful if you are with a therapist who is not affirming, because those couple of years, like, you're kind of a shit show sometimes.
Yes.
Right. There's a lot of bouncing around and you're like ping-ponging on different things, and having a therapist that can be like, yeah, let's talk about that ping-ponging around. Right?
Container and a guidance is definitely helpful,
Yeah.
but I agree with you. I don't think it's mandatory. Like, a lot of people who have done it without therapy, they had great support. And in fact, a lot of times I see therapy not being helpful if you're with a therapist who has no idea what they're doing, and they're seeing you for 6 months just to send you off for hormones or things like that. And I'm sure you've seen it too. Speaking of body autonomy, in relationship to the evaluations you and I do a lot of evaluations for gender affirming surgery. And body autonomy becomes a very important concept. With WPATH just about to modify their guidelines, what do you wish to see in there in relationship to adults and body autonomy and particular surgical procedures?
I think that it is, I don't think there should be any letter requirements regardless of the procedure. I think that as long as there's a letter requirement, we are still looking at trans and non-binary people as having a mental illness that could compromise their inability to make decisions about themselves and their lives. So I think that mandate should be removed entirely. I do think there should be parts of the process and surgeons, different people, making sure that resources are available for people to engage in therapy during that process. But I just don't think that it should be required at all. I actually think that surgeons and should actually bear more of a brunt of responsibility than therapists often do in this process. So, you know, after somebody has surgery, they do actually need some support. There are things that they absolutely do need. I think surgeons should be responsible for post-op care coordination. They should have therapists on staff that patient has access to, that's part of their insurance or part of their surgery, that person can access and say, I'm not feeling well today emotionally, as opposed to that person trying to like go out and find a place, you know. So much of the medical care has been discharged onto mental health providers. And then you have like sort of, you know, the capitalist and insurance and the exploitation, like that was a whole other sort of concept. But from a letter perspective, I think they need to be eliminated entirely. I anticipate that we are closer to maybe not 2 letters for some surgeries and 1 for others. And there's a possibility that they'll remove the surgery or the letter requirement for breast augmentation and chest masculinization. I think that, but I think that we are a long way away from there being no letter requirement, unfortunately.
I really hope so, because I see people wasting their time. I see us wasting our resources where we could be doing something much more valuable, even though it is valuable right now in the context of the moment. I agree with you that the surgeons need to bear more responsibility, and because it makes no sense. You and I often evaluate people who are not even somebody we see on an ongoing basis. So these are people who walk in our door for evaluation, and that's it, and we never see them again. So for us to be part of their ongoing care is ridiculous and just not feasible given our private practices, right? And I do wish, and you and I talked prior to this interview, I do very badly wish that if you've been diagnosed, you're in the medical system, you're getting medical prescribed hormones. As a result, when you're ready for any kind of surgeries, your doctor, especially hopefully hormone provider who sees you more often than evaluators like you and I do, should be able to say, okay, so seems like you're ready. All right, let me put referral for you. And it just streamlined referral process without any letters. And God, I really hope we're going to get there. Switching gears a little bit onto your personal life, if you don't mind. I know you've been married to Johanna Olsen since 2015. I know Johanna as well. She's incredible. She's a medical doctor that works with children primarily and families at LA Children's Hospital. Can you tell me a little bit more about your relationship and how you guys met?
Yeah, we very, very first met at a gender conference in San Francisco. It was the Center for Excellence, their first conference, which I think prior to COVID, they used to have every other year, I think. she was presenting, and I really wasn't kind of in the depths of the work at that time. I was attending the conference as somebody who's doing like case management in a small town, and was like going to a gender conference. And as I was sort of milling around the conference, I sort of heard people are like, "Oh, that's Dr. Olsen," and I was like, "Who's this Dr. Olsen?" Like, you know, I didn't even like. It was like clearly people were excited about her, so I got excited about being excited about somebody. And then the conference had ended, whatever, and we were both at a crosswalk to cross over to like where the reception is, whatever. And Joe and this other now friend of ours were behind me, and they were both sick, which now in a time of COVID sounds terrifying, but at that time it really wasn't. And they were kind of cross complaining about like, you got me sick, whatever. And Joe sneezed, and Joe is a 3-dimensional sneezer, and it's an experience. I'm sure, always has been. And I didn't know who she was, I didn't know who the people were, so I kind of made a joke. I was like, as if she'd spit on the back of my head, right? And that was my perspective. That was the end of the interaction. We crossed the street, and that was it. About 2 months later, there's another gender conference, Gender Spectrum, in Berkeley, and I'm there again by myself. And I'm married at this time, and Joe's married at the time to somebody else. And the person who did not, the other person came up and she said, "You're familiar. I know you from somewhere." And I was like, "I don't know." And she was like, "You were in front of us at the gender conference in San Francisco," and sort of like takes my arm and like brings me to go hang out with people. And that's where Joe is. Over time in gender conferences, you know, and back in the day, gender conferences was like, it was very summer, right? So from like June into August, it was packed. Now they're all year long. And so every year we would hang out, and we were creating these friendships with her and Susan Landon and a variety of other people. And at that time, Joe just became like, I just had so much respect for her as like, she was my mentor. Like I loved her approach and the way she did the work. And I was, you know, I often found myself kind of fangirling a little bit, like, you know, and like Joe would be like, "Hey, Aiden," I'm like, "Oh, she knows my name," and you know, like this whole sort of thing. And
oh,
you know,
great.
Yeah, and years passed by, and we had become, myself, Joe, and Susan Lane had become very, very good friends. And my brother and right after that, my wife asked for a divorce, and so my life was like not great. It was not a good time. And simultaneously, Joe's marriage was ending. And so things were not going well for her. So we were in Seattle at Gender Odyssey, and poor Susan, the only healthy one in the bunch between the three of us, was like trying to support each of us. And there was something about that time where our like anymore, like actually, she was actually a friend. She was actually somebody who was in my life, and we were kind of sharing this relationship. And then the following year, which was the next time that I saw her, I was completely divorced. She was, you know, separated, and it just sort of, I don't know, it was just like, oh, this is weird. There's weird energy between us. But it had been at that point 5 years of us every summer kind of coming together and doing this work together. So I later found out that Joe had seen me earlier at that first conference sitting on a wall, and I'm very known for like this solo kind of contemplative thing, and she noticed my tattoos, and so she had noticed me much earlier. But and then I graduated in 2013, and by that time, you know, we were both in a place where we had space to be in a relationship, and so I moved down to LA, and that's this history.
I love that story. I love how you still get tender talking about this story. That just shows how much you care for her and love her. And I love the work she does at Children's Hospital. So I'm also going to take her for interview here as well.
Yeah, fantastic.
I think people like the two of you are very, very important. Now, the final question, I know we're running out of time, that I would like to ask you is, I know you're also a parent, you and you're also parents. Has your personal transition changed or influenced at all in the ways that you parent your children?
I don't think so, but I don't know that I would know, because by the time I came into my kiddo, who's now 14, by the time I came into their life, you know, they were 6, and I was, many years into transition. And so I don't have anything to compare it to, but I do think that there is, and so I think sometimes, I mean, I don't spend a lot of time because the idea of it is not exciting to me, but like, I think about like, what if I was like a cisgender straight guy, which I'm not interested in being either of those things, but how would I be in the world? How would I see the world? And then how would I interact with people if my lens had been reduced in a way that I think cisgender heterosexual lenses are often reduced, and I don't know. I know that my kid, a lot of their friends don't know that I'm trans, which is interesting because going back to that thing of like, I don't actually like people not knowing. It makes me feel weird, right? And so like their friends will be here and they'll make a comment, like if I have my shirt off and they have scars, right? I don't think a lot about it, but I think about it sometimes. But I have vegan tattooed across my chest, and almost always that gets way more attention. So I don't think so. I think that my kid is first year in high school, and a lot of their friends are experiencing all sorts of genders and sexualities and names. And I think that the benefit that Joe and I have is that when our kid comes home and is like, oh, Sally is now going by salamander, we're like, cool, all right, fine. Oh, they're using these pronouns, awesome, fantastic. So I think there's a flexibility that we have that meets our kid with their generation that I think other parents maybe who are not part of the trans, queer, non-binary community, it may be harder for them. So I think that from that perspective, it's probably a benefit.
They're so lucky to have you. I have yet to meet your kids. Hopefully I will one day. I'm very excited about that. Well, thank you so very much for coming and spending your time with me and talking about this. I think this could be incredibly helpful to a lot of people, especially some of the topics we touch based on. Hearing another professional in the field is always beneficial because in my experience, there's very few people who solely focus on gender issues. So it's always great to have you. Thank you so much, Aiden.
Absolutely. Thank you for having me.